Hi, welcome in. My name is Joseph Holyfield. I'm the surgical assistant here. I'll be going over some post-op instructions just in case that you didn't get a chance to look over them before surgery. This way, sometimes surgery can be stressful. We want to make sure that you're not alone and that you feel confident coming in today. On the top of the sheet will be the doctor's information. Phone number, email will be there. The doctor typically will email at the end of the day to kind of make sure that you're doing okay and everything's going okay. Always look out for that email first. Also, his cell phone number is there, so if you have any questions or concerns, you're welcome to take pictures. You can email those pictures, you can text those pictures. The doctor just wants to make sure that everything's okay, and always use these resources first before reaching out via phone and calling the office. That may have to wait for a voicemail to get back. You will be numb following the procedure, typically about 2 to 4 hours following. The big thing with that is to make sure that you wait till everything wears off before you have anything to eat or drink. That way you're not accidentally burning yourself or biting yourself. If you do find yourself getting hungry and you notice that you're still a little numb, always go for something that's a little bit colder so you don't have to worry about temperature, and something you don't have to do any chewing with. Something really simple, Jell-O, yogurt that you can just swallow. Discomfort is typically at its highest the first 3 days. It's typically somewhat of a roller coaster, so it'll kind of peak up, and then around that third, fourth day, it should start to come down. That's just kind of normal with any procedure, so it's always recommended that you take the first dose of medication as soon as you get out of here, and that way you're just ahead of any pain associated. And then do that for maybe a day or two, and then you can see how things are feeling. For most surgeries, the bleeding should be pretty controlled. We'll always give out a pack of gauze to send home with you in our little post-op bag. With that, all you have to do is fold it up, the gauze, either bite down on it or hold it in the area, and then typically about 20 to 30 minutes of that, and that should stop any bleeding associated with the surgery. Some slight jaw soreness or sensitivity is normal with all procedures. It all kind of depends on how long your mouth is open, but with that, if you do notice some of that, just either go online and practice some massaging techniques, or you can use some cold or warm compress, whatever feels good for you to kind of help with that. Some slight swelling is typical with any kind of surgery. We always recommend that you ice for the first 24 hours as much as possible. And then right on the outside, 20 minutes on, 20 to 40 minutes off. You do that again for 24 hours, and then after 24 hours, typically if there's any irritation in the area, you want to switch to heat. With all surgeries, we recommend that no smoking, if possible, for at least the first 2 weeks. And then, if you do have, a smoking habit, you just always want to try your best not to smoke, and just know that you're not alone. So you will go home with a rinse. It's an oral rinse. Basically, you'll do that 2 or 3 times a day. Soft tilts of the head, nothing too vigorous. You want to do that basically when you brush your teeth. It will sting your teeth after about 7 to 10 days, so you always want to look out for that and discontinue when you start to see the staining after that time. Also, taking the rinse after you eat and brushing your teeth after the rinse is always recommended, and that kind of just helps with the daily buildup. If sutures were placed during your treatment, they'll typically get removed somewhere between 2 to 4 weeks. With that, basically just try to keep your tongue away from them and not play with them as much as possible. And then also, again, no brushing in those areas. Okay? We'll send you home with a red toothbrush, super soft bristles. After that 7 to 10 days of the rinse, you can go ahead and start using that brush. You want to have somewhat of a paintbrush motion away from the gums, not into them like you normally would. That way, kind of just make sure that the surgical site is intact. And then once you do start to brush in there and things start to feel a little more comfortable, you'll be coming back in for your suture removal, and then we'll give you some updated instructions.